All right, the recording is started. We're good to go.
Okay, thank you. Welcome, everyone. This is the Boulder County Board of Health regular meeting. It is May 12th, 2025. The time is 5:31. This is Morgan McMillan, board president. I'll ask the other board members to introduce themselves, and then we'll move into the agenda.
Hi, this is Lindy Hinman, Vice President of the Board of Health.
Hi, this is Amber Johnson, one of the board members.
Great, thank you.
And it looks like Brooke just joined.
Oh, great.
Brooke, are you on? Do you want to introduce yourself for roll call?
Oh yeah, Brooke Harrison, board member.
Great, thank you. Hi, nice to see you all. Item number 1 is public comments. I don't think we had any submitted. Just checking to make sure there's no members of the public waiting to speak.
I don't see anyone. Yeah, no comments submitted, and I don't see members of the public online.
Okay, great, thank you. Item number 2 is approval of the April 14th regular meeting minutes.
I move to approve the April meeting minutes.
I second.
Great, all in favor? Aye.
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 Great, thank you. Minutes approved. Item number 3 is the quarterly budget update.
All right, can you hear me?
You're good.
Sounds good. Good evening, Board of Health. Thank you for the opportunity to provide a financial update for the first quarter of 2025. Next slide, please. Or do I have access to that, Patrick, for the slides?
Yeah, if at the top of the teams, you can choose take control. There should be a take control button, and then you'll be able to navigate them if you want. There you go.
Okay, perfect. Sounds good. Thank you. So I just want to give a quick executive summary. I'll start really high level. First quarter, we brought in about 19% of our annual budgeted revenue, slightly behind the first quarter mark, which is about 25%. The shortfall is mainly due to delays in federal and state disbursements. And then on the expenditure side, we came in about 22.5 of the budget, well within the range, so slightly underpacing, which is primarily due to operations on vacancy savings and obviously operational expenses. Overall, we remain stable in position, and we expect mainly these variables, the variables to really change in quarter 2, and we'll start speeding up on some of the expenditures and also hopefully on the revenue side. I'm going to go on to the next slide, really is talking a little bit about revenue. Just a little bit more into detail. Obviously, we should be at about a 25% with revenue. We came in about 19, which that created a 1.3 million shortfall. As we continue to monitor, it's not very alarming right now. We know that there's some delays in reimbursements, and usually around this time of year, we do have those type of delays. Second quarter, we'll keep a closer eye on just the revenues themselves, but we're right within the 25% mark. We're at 19 and a 1.3 shortfall. And then on the expenditure side, just break it down a little bit more. First quarter, our expenditures were 5.5, 22% of that versus a 25% on budget. So primarily most of it was on the personnel, which came in at 24%, and then operational came in at 13. Still within the budget, but slightly higher on the personnel side. So we will be monitoring that. And a lot of that is just revenue not coming in. So we'll continue looking at those expenditures, but we've also made some changes to our expenditures, just kind of watching expenditures and contracts. So we'll continue monitoring those to make sure we're on pace on that 25%. So nothing to worry about there, just flagging just a slower lag. So we'll continue monitoring that. And just to kind of talk a little bit about overall first quarter, just really the biggest risk areas is the revenue, and everybody knows the environment that we're in on the federal and the state. So the uncertainty, we continue to monitor that, but we've been very successful drawing down the revenues as they come in on a timely manner. Slightly some delayed ones, but we'll continue monitoring those. And then overall, the operational lag, we'll continue to monitor expenditures and making sure that, you know, divisions are spending because we came in under. So we'll continue to ramp that up second quarter. And just to kind of conclude this quick presentation, I do send these out on a monthly basis. So this is nothing new. You've been getting these on a monthly basis. If you do have questions, please, you know, reach out to myself. But fiscally, right now, our position is stable. Revenues, like I said, slightly delayed, but I believe they're temporary. But we will be looking at those revenues second and third quarter, and then expenditures, just being a little bit more conservative as we manage our expenditures. And then we'll just continue monitoring these next couple quarters. And then we will be bringing back a budget amendment here probably third quarter, end of second quarter, third quarter, making some adjustments. And then also as we continue working on priority-based budgeting, we're currently in the phase where we're really rebasing the budget for 26, which will have an effect on the 25 budget. That concludes my presentation. If there's any questions, love to hear the questions, and I'll pass it on to you, Patrick.
Any board members have any questions about the budget update?
Nope.
Okay, thank you, Armando. We appreciate you keeping us in the loop.
Thank you.
And all the work that the staff is doing also to just maintain our fiscal strength. Okay, item number 4 is policy update.
Good evening, Board of Health. Lexi Nolan, Executive Director at BCPH. I am happy to be able to report back what's been happening in the policy space. We've been working with a lot of partners this year during the state legislative session. And our staffing, our internal staffing for kind of coordinating this work has shifted a bit. We started the year with Lane Drager and Dave LaRocca coordinating our policy work. Lane retired, and Dave has taken another position with, I think, the American Soccer Federation, doing evaluation work. Very exciting job for him. So I have stepped in coordinating our internal policy group, and I really want to thank staff who have helped in this process so that we could all stay together. You all know it's been a challenging state legislative session this year, and of course we've had some recent federal churning, so we'll take a quick look at both of those areas. Next slide. You can go on. Thank you. So this is the list of, this is our wins on the Senate side, bills originating in the Senate. In relation to the long bill, we did not see any reductions to our per capita funding for public health agencies. We did see a slight reduction in Family Connects of 10%. But we're waiting to see what the local disbursement looks like, and then a CTC reduction of 30% to that grant for Boulder County. The remainder of the bills, you can see they either passed or we are pleased that they failed because we had taken a position against them. A couple of bills to kind of lift up a little bit. The Healthy Schools Meals for All passed. The reimbursement for community health workers passed, but it's been postponed from July 1st to January. We suspect that by the fall, the legislature may have a special session called to talk about whatever decisions the feds make around Medicaid, and we'll revisit that bill at that time and decide whether they want to continue moving forward with it or if circumstances warrant going ahead and rescinding that decision for HCPF at that point. That was a bill that we had some of our staff, Mary Faltinsky in particular, had lobbied on and in partnership with Children's Hospital And the other bill that I really wanted to lift up was the triennial review for the retail food establishment license fees. That's the charges for food licenses that benefit our food inspection team. It has not been reviewed in 6 years because they skipped a cycle during COVID. So this was actually a beautifully run process. It took a long time. We had folks, including Tom Gonzalez from Larimer County, who were working very closely with the state and the Restaurant Association to get that bill through. And what they approved is an increase of 25% the first year, compounding 20% the second year, and another 20% the third year. So it ends up being over 80% increase after 3 years to our food inspection teams, which is a huge win. I'm very appreciative of that work. And the last one I wanted to lift up was the implementation of the Colorado Natural Medicine Initiative, which provides for a significant amount of tracking and research to see the impact of the use of natural medicines and particularly psychedelics on our youth. This was part of an effort to recognize that we need to keep better track of how some of these bills are impacting our communities. And so we were happy to see that passed. Any questions on any of these? Next slide, please. These are our wins from bills originating in the House. The Gender Identity Certificate of Death bill passed, which allows folks to have their preferred gender reflected on their death certificates. The efforts to reduce food waste passed, so this will allow restaurants to repurpose food to reduce waste, working with food banks and others. The Colorado Cottage Foods Act failed. The reason public health took a position against this is that there were concerns that, so this would relate to, for instance, folks selling tamales or things out of their homes. And the way it was set up makes it pretty difficult for public health to do its job of making sure that food is safe. But we do expect this bill to come back next year, and it seems to be gathering support with community members who are framing it as a local small business and a minority-owned business supporting act. And so we will be taking a careful look at that again next year, I have a feeling. There were some supports to federally qualified health centers that passed, which is terrific. We are going to keep overdose education and opioid antagonists in schools. The food truck operations bill passed, which mostly had to do with licensing across jurisdictions, protecting access to gender affirming care, attempting to hold requirements for gender affirming care and health insurance at the state level. And then the Kelly Loving Act passed, which supports LGBTQ communities in terms of supporting the use of pronouns in schools and names, name changes, and things like that. So those were all a number of wins for public health this year, bills that originated in the House. Any questions on this one? You all know that this legislative session was pretty challenging generally, and there were a lot of bills that didn't move forward because they had fiscal notes attached to them. I think we would have seen more public health related bills if not for that. There were quite a few bills, but really not a lot that related that had fiscal bills attached. Next slide, please. These were some of the places where our advocacy position didn't win the day. There were some grant programs shutting down, school mental health screening was repealed. The Radiation Advisory Committee was repealed at the state level, and increasing public awareness of mold health effects. Didn't take any action, nor did septic system replacement enterprises. So those may come back next year. We're looking forward to having a full-time policy person to help us prioritize which bills we really want to revisit and prepare for before the legislative session. And I imagine some of the ones that we were supporting that didn't move forward would be on that short list. Any questions here? We're moving quickly tonight. Okay, next slide. So I did attend a director's retreat last week with CDPHE, and we got a little bit of information about how we're going to approach the July 1st state contracts. They will be developing contracts based on any funding that they have already actually received. They will not include federal funds until they've been received. And when I asked about, what would you suggest in terms of how we plan for this? If we know that grants aren't going to be as robust as they have been in the past, but it's not certain. They really didn't have advice about whether we should front load the grants, hoping that additional funds would come in, or whether we should plan for a full year of reductions. What I imagine we will be doing internally and in conversation with other LPHAs is looking at them on a grant by grant basis to look at kind of the risk that we would be taking on and what the long-term planning strategy is around some of these grants. Any questions on that piece so far? No. Okay. And then in relation to working, I'm sorry, could you go back a slide? In relation to working with CALFO and MDPH, we are talking about how to strategize to work more collaboratively around regional and shared work. How can we share resources more? And how can we coordinate priorities? As an example, Boulder County doesn't have a Title X clinic, and Title X clinics are very vulnerable right now. Jeffco and Larimer both have Title X clinics. If the Title X funding gets reduced, we would want to have an approach where we can ensure that some of the Title X clinics survive and that they're geographically proportional. Representative around the region, rather than everybody taking a hit and nobody, can really be able to fund full services in their clinics. So we're talking about those kinds of issues as we go forward, and also talking with each other about, what specific areas are groups prioritizing and how can we work together. Any questions there?
Hey, Lexi, this is Lindy. If we could go back to the CDPHE bullets, can you just clarify for me or Armando how we are looking at federal funding right now, and are we following the same rule of thumb, which is we won't include them until they've been received, or how is that translating to us?
So we started that early in the year, as soon as we found out, right around January. So we've been very careful. We really don't spend until we have it. We draw it down. So what we've actually been doing is drawing down a lot earlier. So before we'd wait until we accrued the expense, now we're drawing down as much as we can. So we have a little bit of a surplus, and we'll just continue monitoring.
Thanks for the clarification.
Okay, and the last slide is kind of some of the areas where we're watching carefully. The naloxone fund, we've heard that it may be in danger. That's about $150,000 allocation to Boulder County. We know that this naloxone has saved lives in real terms. Jeffco estimates it's saved 300 lives in their county. And we feel strongly that it needs to be preserved, but we'll be watching closely and making sure that we are able to support the community in this space. The prevention fund is, of course, under attack. That was part of the Affordable Care Act that was created. under the Obama administration, and it was a significant investment in public health in a way that public health champions cheered. And we are concerned that that fund will be going away. We are keeping an eye on WIC. We have heard that the EPA is taking some significant hits, especially around environmental justice and climate work. We are watching what's going to happen in relation to coverage of gender affirming care. A statement was put out from the federal level recently, arguing against medical services for gender affirming care and only recommending psychotherapy. So we'll be watching to see if there are formal proposals that follow that. We are concerned about the public health emergency preparedness funding. We have heard that it may be reduced. We have not gotten that contract yet. We are also concerned about the Vaccines for Children program. All of our immunizations are provided by the federal government. And so if that program goes away, we would have to look at what we could do to support that program going forward or else sunset it. The tobacco education and prevention program, maybe seeing some cuts in the future. We have heard that AmeriCorps is going to be significantly reduced, and we are concerned about childhood lead exposure funding. Now, the good news is that we've been engaged in this priority-based budgeting process for a while, and we've made some significant progress. So we are not unprepared for this. We hope, of course, for the best, but we will plan for the worst. And we look forward to talking with you all about how to be best prepared in just a couple of weeks now.
Hey, Lexi, I think you mentioned this in the director's report, but in terms of the timeline for hiring a new policy lead in the absence of Lane and Dave. So what's the timeline for that? And
yeah, we started interviews today. We're interviewing 5 candidates in the first round. We got 95 applications, 95. A lot of them were from federal workers, either at CDC or Health and Human Services or a related branch. A lot of really qualified folks. We are very particular about what we're looking for. We're looking for kind of the person that kind of fits our particular needs specifically and is ready to do local systems change work as well as the policy work. The timeline, we're hoping that they would be able to join by July.
great.
And that
Any other
concludes my
Yeah,
presentation.
okay.
Any other questions?
Any other questions from the board on policy update? No, okay. Thanks, Lexi, for walking us through that. Busy session.
Yes.
Item number 5, director's report.
I do not have anything specifically to lift up, but happy to answer any questions.
Writing, any questions from the board related to the director's report?
Yes, I have a question, Lexi. You had talked about, sorry, I'm trying to find it. Apologies. You had talked about an update to Medicaid funding related to, oh, sorry, I cannot find it, but there was a Medicaid update, and I just wanted to see if I could get you to clarify what exactly happened there.
Let me make sure I know what you're talking about. Are you talking about the Genesis staff testimony?
Yes, that is what
Yeah.
I'm talking about. Yeah, sorry.
Right.
Yes.
So that
And it
was in
sounds like-
relation. Mhm.
Yeah, go ahead. Nope, go ahead.
That was in relation to that community health worker bill that was proposed to be funded, proposed by HCPF a couple of years ago to be funded by Medicaid. That program would support a number of our staff and allow us to retain them. That is the proposal that was delayed until January. It was supposed to start July 1st. It'll be delayed until January. And our suspicion is that that delay was reflecting on the potential for the federal budget cuts to affect Medicaid, and that the state legislature may pull that opportunity back entirely in the fall. So
Yeah,
we'll have to
that's-
see if that stays.
That was what I was trying to, okay, thank
Yeah.
you.
Mhm.
Appreciate that. And then Lexi, the other area that I was curious about, I know you gave a really detailed report around the measles outbreak, but is there anything else you'd want to make sure that we're aware of as a Board of Health as it relates to the measles preparedness?
No, our team's doing great. They have run through a number of scenarios. They have been working with the schools. They're in a terrific position. We have not seen significant churning yet in this space. We've had a number of suspected cases, but we just continue to work through them. The team's doing a really good job.
Great, thank you.
Indira, go ahead, Indira. You're going to have to speak loud.
Oh, yeah. So sorry, I'm having audio issues. The team did a really good job with a planning exercise where they brought in early childcare and also the school districts. And they have also had conversations with their healthcare partners. So we are feeling pretty good about all the relationships that we built and how we're going to respond. And the emergency management team did a great job of kind of walking us through a difficult scenario. And I think that for the most part, we're in good shape. You know, our school districts are around 95%, but that early child care, that younger age group under 5 is usually the most worrisome. So we'll be keeping our eye on them and supporting them. And then we are actually going to have a discussion with our healthcare systems, our chief medical officers coming up here soon, where we've invited Dr. Rachel Hurley to kind of give the overview of what's happening at the state level, how many tests they're doing, and then also Dr. Belknap is going to talk about their experience in healthcare when you do have a case and the exposures in healthcare settings. So I think that we're all getting very, ready, and I think the team is ready to respond, but it will be a big lift because normally there's a lot of exposures, and I don't know if anyone else is on from the team, but I have full confidence in their ability.
Sorry, Indira, I might have misheard this, but did you say that the under 5 vaccination rate is 65%?
No, I'm sorry. The under 5 vaccination rate is lower. They need that one dose at age 1, but they don't get that second dose until age 5. And so, for early child care centers, we want to make sure that their staff are vaccinated, that they are aware of their staff that are vaccinated, and then also working with parents to get their vaccine records to make sure that we have accurate data. Because, what we don't want to do is actually have to send children home just because their records aren't on file. So I think the early child care centers are working really hard to make sure that they have all their records on file. So they don't have to leave children out, because that's not what we want. It's not good for parents, it's not good for kids. So we're just trying to strengthen that record keeping to make sure that their systems are in place should they have an exposure at one of their centers.
Our communications team has also put out a few releases, and Carol Helwig was on a panel the other day about vaccinations, did a great job. So shout out to Carol for that. Thank you.
Awesome, thank you. Any other questions from the board related to the director's report?
I had a question, just a shout out. I was really struck by the work that the Youth Opioid Overdose Prevention Program is doing. I mean, I think getting Narcan out there and in hands and doing those trainings while we're sort of concerned about the future access issues with Narcan is concerning. So well done to that team.
Thank you.
Anything else you wanted to lift up from the director's report, Lexi?
Just curious if you all found kind of the reporting on the progress of the strategic priorities helpful, and if you have feedback on how you'd like to see that in the future, just let us know. We'd be happy to switch it up if there's a better way to present it for you.
Well, Lexi, first, I did want to say thank you for all that work. It's very thorough, and I appreciate the opportunity to read it. I'm still working through it candidly because it is rather long. I think maybe what would be, I was actually wondering why we didn't get a report out today on it, more of an executive readout. So maybe my only feedback would be, at least in the summary, to be a little bit more specific, because there's so many initiatives that are covered under each broad category, maybe some highlights for the board that would really kind of emphasize the progress that's been made. Yeah, it's just hard to glean from that first page. So, but I was
Great.
sort of waiting to see if maybe there would be more in this board meeting or to come, which is fine. But, and then I may have more specific questions as I get through it, but generally just thank you for the work.
Great. Thank you, Lindy. That's helpful. We'll make sure that it's summarized well. And in the future, we would like to have quarterly update presentations at the board meeting too.
Great. We've got a lot to deal with right now, so
There's a lot
understand.
going on.
Yeah,
A
it's
lot going
totally
on.
okay.
I also just want to acknowledge that I saw Joe is retiring, so wanted to thank him for his long leadership to BCPH, and he will be missed. And
Very much.
thank you to Joe for serving in that position and being part of this team for so long. If there are no other questions about the director's report, item number 6, old and new business.
I have
No.
nothing for you right
Okay.
now. We continue to work hard on the priority-based budgeting, and we'll be getting back to you soon on that.
Okay, hearing no other updates, I'm gonna say item number 7, adjourn. Thanks everyone for an efficient meeting. I'm gonna make the end of my kids' Little League game, so
Have a good night.
thanks everyone.
Thank you.
you.
Take
Bye.
care.
Right.